Hello, everyone, and thank you for attending today's webinar, Benefits of a Proactive Approach to COB, presented by CAQH. I'm Michael Shoshua, and I'll be moderating this webinar. Our speaker today is Rebecca Beatty, MPH, Product Manager at CAQH. You can read her full bio on the left side of your window by selecting the Speakers tab. Just a few technical notes before we begin. If you'd like to download the slide deck, please click the Handouts tab button on the left side of your screen. The webcast is being streamed through your computer, so there is no dial-in number. For the best audio quality, please make sure your volume is up. This webinar is being recorded and will be available on demand within 24 hours after the event. Time permitting, we will follow the presentation with a Q&A session. Please submit your questions using the Questions and Answers tab on the left side of your screen. Let's begin. Rebecca, please go ahead.
All right, thank you. As Michael mentioned, my name is Rebecca Beatty, and I am a Senior Product Manager at CAQH, where I focus primarily on coordination of benefits. For those of you who are not familiar with CAQH, we are a nonprofit alliance of health plans who have been brought together to try to focus on reducing administrative burden in the industry. And so we have three arms that focus on this mission. First is CAQH CORE, which stands for Committee on Operating Rules for Information Exchange. Some of you may be familiar with CORE. We do have more than 130 participating organizations who have become CORE certified, which means that they have agreed to maintaining these operating rules for information exchange. We also have our explorations arm, which is the research arm of our organization. And if you've read the CAQH Index, that's a report that we put out every year that benchmarks progress against industry adoption of electronic administrative transactions. And then finally, I'm here representing our solutions arm today. And our solutions arm is the part of our organization that creates what we call industry utilities, which are solutions that are designed for industry-wide adoption. And the more health plans who participate, the more we're able to standardize certain things across the industry that are not standardized today. And so COB Smart is our coordination of benefits solution, and I'll speak a little bit more about that later in the presentation. But we also have probably our better known solutions are our provider data solutions, ProView probably being by far the most well-known. And then we have some other solutions that work with ProView to work on standardizing provider data. And as I mentioned, we are a nonprofit alliance of health plans. So here you see the board members that work with us to define what industry challenges we're going to work on to tackle. And they've really informed a lot of our work around coordination of benefits and the best practices that I'll be sharing with all of you today. So we want to talk a little bit about some of the challenges that we have seen in the industry related to coordination of benefits. So for anybody who needs a reminder, coordination of benefits essentially allows plans to determine which insurance plan has the primary payment responsibility and the extent to which the other plans will contribute when an individual is covered by more than one plan. So if a member has insurance with Plan A and Plan B, coordination of benefits determines how much Plan A pays for that member and how much Plan B pays for that member. And there is quite a bit of opportunity for savings if coordination of benefits is done well. There's benefit both to the payer and to the member. So there's a lot of opportunity here, but we've found that many payers are not able to really fully realize these opportunities because we've seen quite a few challenges related to performing this well. The first being, of course, that most of the data that plans have access to perform coordination of benefits tends to be given to them retrospectively, and it's also a highly manual process. So there's not a lot of opportunities for automation, especially when you're working with retrospective data. There's also really no common language that health plans benefit, so it's hard for the health plans to work together. And then when they are working together, they're often working with out-of-date information. So if health plans are just getting information maybe once a year from a member survey, or they are getting information gleaned from claims data, by the time they actually receive that information, it may be very much out of date. And so quite a bit of time and energy needs to be expended to determine if that information is still accurate or needs to be updated. Is it possible to advance to the next slide? Okay, thank you. So what we've noticed is that this reactive process causes inefficiencies across multiple stages of the payment process. So when you have patients coming in and you're trying to capture their insurance information, oftentimes that's not captured correctly, and then that flows down through the entire payment process, resulting ultimately in a lot of appeals and adjustments, which are very expensive and which are not the most efficient way to handle coordination of benefits. And there is a pretty significant negative impact on plans, providers, and patients resulting from this process. On the plan side, there's a lot of administrative burden on the health plan to try to get this right, especially when you're dealing with a very manual process and one that tends to be highly retrospective. There's also a lot of expense associated with paying claims incorrectly and having to use vendors to recover those claims. So there are costs both to perform the service and in recovering the payments themselves. Providers also, if they have to be involved in the coordination of benefits process, tend to have to deal with a lot of phone calls from plans that tend to be very disruptive to their workflow. And they also, of course, do not like when their payments are incorrect or delayed. And the same with patients. When they are getting these COB letters, they often do not understand them. They don't understand how the coordination of benefits process works. So they really don't understand why, if their claims are being paid incorrectly or being delayed due to improper coordination of benefits, that's really not something that they understand. And we estimate that all of this inefficiency costs the industry around $800 million. And so there's definitely a lot of opportunity in this space to improve the process. I also want to just make a note, for plans with Medicaid membership, there is definitely a unique challenge for those payers, but there's also a unique opportunity there. One of the challenges that we hear from payers with Medicaid membership, of course, is the mandated use of state-generated data, which can vary quite a bit in quality. And one other thing that's somewhat unique to the Medicaid population is that they may have frequent changes in coverage. They may actually go on and off of coverage within a week, which is certainly not something that we see very frequently with commercial members. But because they may be going on and off coverage so frequently, very, very important to have regularly updated data on those Medicaid members. And so if you're only getting that data once a year, it tends to be very outdated. Then there is also a unique opportunity there, though, because for one thing, Medicaid members often have higher rates of multiple coverages. So there's quite a bit of opportunity, especially because Medicaid is, of course, the payer of last resort. So if you identify other coverage on your Medicaid members, there's significant savings to be achieved by doing coordination of benefits correctly. So as I mentioned, we've worked with a lot of payers to find better practices for coordination of benefits. And so I want to make some suggestions for how to improve the coordination of benefits process. So there are multiple best practices that we've found in working with payers over the years on coordination of benefits. The first being that we highly recommend, instead of taking a reactive approach to coordination of benefits, to try to be as proactive as possible. If you can get the payment or the coordination of benefits data before you receive a claim, then you can eliminate a lot of those downstream processes that result when you have to do it reactively. Of course, in order to do this, you really need access to high quality data. All of these best practices really hinge on having good quality data to use when making payment decisions. Another thing that we'd recommend is actually prioritizing your high dollar claims. You have limited resources, which of course we know that most payers do. Having the ability to work just those high dollar claims first is often a very good opportunity to save the most money in a faster period of time than if you're doing a different process. And of course, as we are someone that promotes a lot of automation, any opportunity that you have to automate your COB process is definitely an area for cost savings and for increased efficiency. And then finally, we highly recommend that everybody stop sending the COB letters. We'll get to that. We'll discuss all of these in more depth, but that's an area that we believe is highly inefficient. The patients don't really appreciate it, they don't understand them, and you will not be getting high quality data if you're using COB letters. So the first best practice, of course, is to take a more proactive approach. So this is what we would argue is sort of the holy grail of coordination of benefits, being able to access high quality information on your members and any other coverage that they may have to determine who is the primary and secondary payer in that overlap, and to get all of that information loaded into your system so that it is available before any claims come in. Because we always believe if you can pay right and get it right the first time, you have an enormous opportunity for cost avoidance, and you can also eliminate a lot of costs downstream that result from taking a more reactive approach to coordination of benefits. In order to do this, of course, you do really need to find a primary source of high quality data. So there are several questions that we suggest plans ask themselves when they're evaluating the sources of the data that they're using for coordination of benefits. So the first question, of course, is where does this data come from? Is it coming from your members? Are you getting it from claims data? Is a vendor finding it for you? Or is it ideally coming directly from other health plans, which would be, in our idea, the most high quality data, because that's certainly data directly from the source. Also, how often is the data that you're looking at updated? Is it being updated just once a year when you're sending out member surveys? Are you getting it sporadically when you're looking at old claims data? Or, are you getting it more frequently than that? Because as we discussed earlier, it's very important, especially with certain populations, to get data more frequently so that you know that it is still current. When do you receive it? Are you receiving it before or after your claims are paid? And how much does it cost? Of course, coordination of benefits is primarily done as a cost-saving measure. So if you're spending too much to acquire the data, that certainly cuts into the savings from coordination of benefits. And then we recommend looking at the impact to your staff and also the impact to your members. So when you're getting the data in, is it easy to use? Can you automate it? Does it require a lot of double checking? Because all of that, of course, puts more burden on your staff and increases the cost to you. And then in terms of the impact to your members, if you are getting this data from your members, there's a pretty big burden on them, especially when many of them do not understand how coordination of benefits works. Another thing that we'd highly recommend that may be surprising to a lot of people is really to make sure that you are not neglecting out-of-state data. One of the things that we've found with the payers that we work with is that, in fact, almost a third of the overlaps that they find are actually from coverage that is in a different state than their member resides. So this is why it's so important to have a national picture of overlapping coverage. If you're just looking within the same state, you are missing up to a third of overlapping coverage. And of course, now as the world becomes more mobile, as more people are working from home and maybe working from a completely different state from where they're employed, we think this is only going to increase. So this is why it's so important to be able to have a national view of membership coverage. So one of the things that I recommended earlier was looking at prioritizing your high dollar claims. So this is a great way if you have limited resources and you can only work a certain amount of data, to do that in a more efficient manner. So this is just a case study from one of the payers that we work with. And they initially, when they started receiving their overlap data, were working it on a first in, first out basis. So they would get a claim in, they would do some research on that claim to determine if that member had other coverage. They would work that, and then they would take the next claim. So in the first year, they achieved some savings. They achieved about $230,000 in savings by doing a first in, first out approach. But then what they realized was that they could actually bump this up against their claims data. And so they started setting a threshold above which something was considered a high dollar claim and was worked in-house, and then below which they considered a low dollar claim, and they actually outsourced that to a vendor. And by doing so, as you can see, they started seeing significant increases in their ability to save based on that data. So they still used a vendor. They were not completely in-house, but they were able to really minimize those vendor commissions by working those high dollar claims with their own staff and then sending the smaller claims out to a vendor. Another area that we, as I mentioned, we really try to promote electronic transactions. So one area that we recommend leveraging is actually using standardized electronic transactions to validate coordination of benefits data. So we know that data certainly tends to vary in quality, especially depending on the source of where you receive it. And so there are standardized X12 270 inquiries that you can send that will help validate whether that data, that overlap is still active. And so this is something that we've just recently started leveraging, and this is certainly an area, if you're looking to automate, if you're looking to find ways to decrease the administrative burden of this, utilizing these standard electronic transactions. And so we've got a sample X12 data stream here to validate data is a great way to decrease the manual nature of checking this coordination of benefits data. So here's an example of a payer who looked to do more automation with their coordination of benefits data. And so this payer used a different approach to checking the quality of the data that they had with checking their coordination of benefits data. So essentially what they would look at was when they got the data in initially, they actually set up an audit process, and they double-checked from the various sources where they were receiving their data, which data they considered green data, so very high-quality, consistently trustworthy data, and they actually were able to automate that data and auto-load it into their system. And then they continue to conduct these ongoing audits to continuously double-check the quality of the data from the various sources, and about 15% still needs to be double-checked, still needs the manual validation process on it. But by creating this, this system of coding data in various colors, this really helped them to find opportunities to automate and to bypass any person having to touch the data before it was automatically uploaded into their claim system. So finally, as we mentioned before, we highly, highly recommend not sending COB letters. What we have on the screen is just to show you that COB letters are actually very expensive. I think a lot of people just think about the cost of a COB letter being the postage or a small amount of processing costs to get it out. But one thing that we encourage you to think about is really once you're sending that letter out, you're sending it to somebody who does not understand what is being asked of them. Frequently will result in multiple calls to customer service to try to understand what this letter is for. And of course, each of those phone calls to customer service is very costly. And in addition, we understand that people tend to get very, very low response rates to these letters, only about a 25% average response rate, which means that 75% of the letters that you're sending out are getting you nothing. And the 25% who do respond, we've found because members really do not understand how coordination of benefits works, they're often, even if they do respond, sending you very bad data. So they may not even know that they have other coverage. If they do have other coverage, they may incorrectly believe that if they tell you about that coverage, that they are somehow going to have a reduced benefit. And so sometimes they will knowingly withhold that data from you because they think that that's somehow going to be detrimental to them if they share that information with you. So of course, sending these letters really is not giving you the data that you need, which means that most likely you're looking at a lot of incorrect payments or overpayments based on this data, which we estimate to be about an average of $350 per member. So if you add up all these costs, the cost of the postage, the cost of sending multiple letters, the cost of having bad data, the cost of phone calls to customer service, we're looking at, for one letter, an average of about $383. So we highly recommend that you find another source of data other than your members, because members really, they are not the best source of data. They do not know the information that you need. And so any other source of data that you can find is certainly going to be better than anything that you might get from your members. And so here's one final case study on, delivering a better member experience by eliminating those letters. So one of the payers found that, they were sending out letters to everybody. These letters were very expensive. Members did not like them. They got a lot of negative feedback from members. And of course, as we mentioned before, yielded a very low response rate. And so instead of getting data from their members, they chose to get data directly from other payers. And as a result, they were able to completely eliminate their member letters, which means the members are no longer involved in the coordination of benefits process at all, which is the way that we at CAQH believe that it should be. And so the results, of course, were that the members were much happier because they were no longer getting these letters and they were no longer being involved in the COB process. But in addition, they actually found a 27% increase in recoveries, and they had identified 21% of overpayments within a relatively short period of time after switching to this new process. And they had also been planning to add 2 additional FTEs to their operations team to work the data that we're getting from the letters. And because the process was so much more efficient and so much better without sending the letters, they actually were able to avoid adding 2 additional FTEs to their operations team. So also a significant savings, not just from the recoveries, not just from the overpayments that had been identified, but also from a more efficient, less labor-intensive process that avoided the need to add additional FTEs to the team. So I want to talk a little bit about the solution that we at CAQH offer. And this has really been built off of a lot of the best practices that we've uncovered in our years of working with payers to better understand what the challenges are and the areas that COB really can be improved. So the way COB Smart works is we, every week, have all the members who participate in the service send us their full membership file. So every week we are finding out from each of those payers all of the members that they have active with them. We then match those members up against all the other members that we're receiving from all of the other health plans to find matching members, and we do have a very strong matching logic that's able to match members at 99.5% accuracy. And then we have a built-in primacy engine that determines the order of benefits. So we're able to determine whether there is an overlap and then who is the primary and secondary payer. And then we share that information back to the health plans every week. So they're getting updated information every week that's coming directly from the other health plans. And they know that that data is trustworthy and they're able to load that data into their system, hopefully before any claims come in. And as I mentioned, we've recently started leveraging these standardized industry transactions to make the quality of the data even better. So of course, we would argue that getting data directly from another health plan is the best data. And then to take that even a step further, now when we receive that enrollment data every week, we are generating an X12 270 inquiry to both payers in the overlap. And that comes back and tells us the correct term date, whether that overlap is still active. And then we're able to take that, deliver this pre-validated data with primacy determined over to the health plan database. So this is really to promote auto-loading, to promote automation, so the payers who are participating trust that this data is still highly accurate, highly updated, and they can upload this data automatically without having to do any further investigation on the data. And so as soon as claims come in, they're able to know that they are the secondary payer and they can pay the claim accordingly. And then one additional major enhancement that we've made to the system is we've developed a web-based portal. So in addition to the weekly file that payers receive every week with all of the overlap data in the file, we do have this portal where members across the enterprise can look up individual members, see what their overlap data is. So if they're trying to just do a one-off search, they're able to do that through this portal. We also have recently added a capability to communicate directly with other payers within the portal. So one of the things that we have understood is that because there isn't a common language, because there isn't an easy way to talk back and forth between payers about a member, especially in a secure fashion when you're dealing with member information, we've developed this capability so that if you've got the portal open and you're looking at a member and you have a question about that member, or you have some information that you need to work that claim, you can actually reach out directly to the other payer in the overlap through the portal. So instead of having to try to get through customer service at the other health plan, try to find the appropriate person to talk to, this just routes the information directly and securely to the other payer. And so we've seen wide adoption of this feature, payers able to communicate directly with other payers and resolve issues about a member right within the portal. So this has been a huge benefit to the members who are participating. We also enable one-off updates of member records. So we want to make sure that the quality of the data that we're getting in is very good. So, you know, we are making multiple ways for the payers to make sure that they're getting updates in about the member records. So they can update a one-off member record directly through the portal instead of having to make that update in their weekly file. We also have some logic that we've built. We can frequently see when a large group looks like it has migrated to another payer or to another plan but wasn't termed. And so this logic enables us to alert a payer that, hey, you have a large group here, it looks like they need to be termed, and with one click, they're actually able to term that entire group. One other thing that we know is very important is when you have court orders or other documents related to a payer, you can use the attachments feature in the COB Smart portal to attach documents to member records. And then finally, you're able to get payer contact information directly through the portal. So if you need to reach out to another person at a payer to get their information or to ask a question about a member that you can't send through the portal directly, we have contact information for all of our payers in the portal. We also have reference documentation in there, and we have an analytics feature, so you can actually track your team usage of the portal. So as more and more of us are remote and have big remote teams, the portal analytics feature is a feature that allows you to see who's working what claims and what activity has occurred in the portal, and you can print all those reports out, and it's a really good way to monitor who's using the portal and for what. So that is the end of my presentation today. So I'm happy to open this up for questions at this point.
All right, thank you, Rebecca. We can now move on to the Q&A, indeed. There is still time to submit questions using the Q&A tab on the left side of your screen if you'd like to submit a question. And there's lots of great questions coming in already. We'll try to get to as many as we can. Our first one here is, these ideas are great, but we use a recovery vendor for COB. Have you heard of anyone working with their recovery vendor to become more proactive?
Yes, absolutely. And, even when payers go live with something like COB Smart, they're going to have often quite a big backlog of overpayments that need to be recovered. So even as you're becoming more proactive in your process, you will still, of course, have quite a few recoveries that need to be made, and no process is perfect. So even as you move more toward cost avoidance, you likely will still have some recoveries that need to be made. So, certainly, even if you're working with a recovery vendor, the more that you can pay claims proactively, correctly, the less that you need to rely on their services. And as I mentioned before, potentially prioritizing your high dollar claims, working those first, working those in-house is a great way to have your recovery vendor work those low dollar claims and save some money there.
Great, thank you. Our next question here, you had mentioned Medicaid MCOs have a unique opportunity with COB. How can I adapt the things you talked about today for Medicaid, where we already have to use files given us by the state?
Sure. So I think, with Medicaid payers, having multiple sources of information is always a good thing. So you're going to get some information from the state, but, we have quite a few Medicaid MCO payers who still use our data because it tends to be the highest quality, and then things that maybe we don't have, the state does not participate in COB Smart. So there will still be information that you'll need from those state files, but we think having more than one source of data is really crucial to ensuring that you do know all about the other coverages that your member has and can make sure that you are receiving the maximum benefit from coordinating benefits.
Great. So will CAQH offer up a real-time API instead of going through the portal?
Yes, so we do have the capability. We do allow payers to use an API. Certainly, we still recommend, even if payers are using an API, still accessing the portal because there's quite a bit of functionality in there. For example, being able to communicate directly with other payers. But if someone is interested in accessing our data through the API, through an API, that's certainly something that we are willing to entertain. It's actually not something that anybody has asked us for to date, but we're aware that the need is out there, and so that's certainly something that we are considering doing.
All right. Next question, and it also has a follow-up. Does your COB database only consist of plans who participate in COB Smart sharing data with each other?
So we do believe that the only data that is up to our standards is data that is directly from another payer. So we do only share data that was between plans that are participating in COB Smart at this time.
Okay. The follow-up is, but do you access another database to capture health plans who do not participate?
No, we do not access another database. We do want to ensure that because we are trying so hard to promote auto-loading, we only want to include data in COB Smart that we consider to be high enough that a payer could take that and auto-load that directly. And so accessing data from another database to us would be a secondary source and would not be trustworthy enough to promote that auto-loading. So we only include data that's directly from the payers who are participating.
All right.
Industry utilities, and they are intended for industry-wide adoption. So the more payers who participate, the more we're able to share data across the entire industry.
All right. Let's see, an audience member would like to know where they can get information on the cost of the COB Smart product.
Sure. So feel free to reach out to me after this presentation, and I can set you up.
Your audio may have cut out there.
Sorry.
Kind of speaking.
Can you hear me now?
Yeah.
Okay, great. Yeah, if you want to just, the person who asked that question, feel free to reach out to me, and I can certainly get you that information.
All right, great. Let's see, this next question looks like our final question for the webinar. We had a lot of great questions today, and we couldn't get to quite all of them, but we'll try our best to get back to anyone and everyone who submitted personally after the webinar. The final question is, do you work with medical stop-loss companies? The audience member saw only providers and health insurance listed.
So right now, our primary user of COB Smart is, of course, payers. We do have a clearinghouse program that we share our data with others, and anyone who has access to a clearinghouse to check that information can check it. We are considering potentially eventually working with organizations other than payers, but as of right now, it's the only people who can participate directly in the system are people who can submit data, and then we do have our clearinghouse program to try to kind of spread this information to the payers who are really the ones who need this information. So the clearinghouse program is the best way if you are not a payer to access COB Smart data.
All right, great. Thank you everyone for attending this Fierce Health Payer webinar and submitting so many great questions. I'd like to thank our speaker for participating and CAQH for presenting today's webinar. This webinar has been recorded. You'll be able to access the recording within 24 hours using the same audience link sent to you earlier. Thank you again for joining us. We look forward to seeing you at future events.